In this video, you'll get a quick overview of the Korn-Zoomer test. I'll explain the Vibrant advantage and the technology used. Then I'll walk through each section of the test, highlighting key features. I'll also suggest complementary tests and end by summarizing the key takeaways and where to go for additional information. The Korn-Zoomer detects IgG and IgA antibodies to peptide-level antigens in corn and also includes the level of corn IgE. In other words, it's a food sensitivity test assessing for reactivity at the peptide level. Peptides are short chains of amino acids, typically 2 to 50 of them, linked by peptide bonds. Note, a chain of 51 or more amino acids is called a polypeptide. In contrast, proteins are made from one or more polypeptides folded into three-dimensional shapes. These large, complex molecules play important roles in the body, from red blood cells to enzymes to muscle cells. Food sensitivity testing measures reactivity to whole, undigested, three-dimensional proteins. Since proteins exist in aqueous, aka watery environments, reactivity to whole proteins is predominantly to the outer, water-soluble portions of the proteins. In contrast, food zoomer testing, like the Korn-Zoomer, measures reactivity to the small, typically not water-soluble, two-dimensional peptides created when whole proteins are digested into smaller fragments. Note, antibodies to peptide fragments will not recognize or bind whole three-dimensional proteins and vice versa. To learn more, check out the peptide versus whole protein handout in your provider portal. Vibrant's Korn-Zoomer is a blood test that can be collected via venipuncture or dried blood spot. Fasting is not required, and there are no dietary or medication restrictions. However, as with all antibody testing, patients taking steroids, immunosuppressive medications, biologic agents, or other immunomodulating medications may have falsely lower or falsely increased total and specific immunoglobulin results. More on this when we get to the complementary tests. Vibrant measures antibody levels using a proprietary microarray plus chemiluminescence. The microarray works similar to ELISA methodology. However, instead of 1 antigen per well, we can measure up to 96 antigens per well. This is possible because we attach antigens to silicone wafers and dice the wafers into tiny microchips, then arrange the microchips, one for each antigen, in a 4x4 or 10x10 grid atop one pillar on a 96 or 24 pillar plate. The pillar plate is then submerged into the patient blood sample, allowing for the simultaneous analysis of a large number of analytes from a single sample. Finally, a high-resolution imager is used to simultaneously detect chemiluminescent signals from labeled antigen-antibody reactions at each microchip throughout the multiplex microarray. Amplified chemiluminescent signals with high signal-to-noise ratios provide high sensitivity, meaning very few false negatives. This automated process allows for high-throughput, sensitive, and specific analysis of multiple biomarkers from minimal sample volumes. Before we dive into the actual report, I want to remind you that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, interpretation, and all markers. I'll be going over the report that includes all 3 options combined, as it is the most comprehensive. Let's start with a quick overview. The Korn-Zoomer sample report includes a cover page, introduction, summary with interpretation, and then lists all markers. The cover page identifies the sample type and includes the results interpretation key. The introduction page is where you can find the methodology and interpretation of report. And I highly recommend reading this page, especially the part where it explains how the Korn-Zoomer summary score is calculated, using a unified score calculated from the IgE, IgA, and IgG reactivity to the respective antigens, with higher weightage for IgE than IgA than IgG, as well as the part where it says, reference ranges have been established for an adult population using 2,000 healthy individuals, and goes on to explain, a classification of green denotes a result that is within the normal reference range. The classification of yellow denotes a result that is moderately elevated with respect to the reference range, and the classification of red denotes a result that is elevated with respect to the normal reference range. The summary starts with the Korn score, and note this patient has a moderately elevated score of 3.2, and then it lists all elevated and moderately elevated results along with an interpretive comment. And then the full report lists the levels of all markers, including corn IgE, and note this patient is not allergic to corn, as well as the antigens found in the corn kernel like corn albumin and corn cry proteins, and the antigens found in corn pollen like corn expansin and corn profilin. The IgA and IgG antibody levels are reported as both a number and plotted graphically so you can visually see how high or low your patient's results are. For example, this patient's level of corn endochitinase, IgG, is in control, but they have moderately elevated levels of IgA to the peptide. If you want to learn more about the markers that are outside of the reference range, you can scroll back to the summary and read the interpretive comment. Let's explore corn cry proteins, for example. Pesticidal crystals, or cry proteins, are endotoxins produced by Bacillus thuringiensis, also known as BT, and have been used to control crop pests since the 1920s. Cry proteins are either sprayed on crops or added to the DNA of genetically modified corn. Cry proteins kill insects when ingested by forming pores in the gastrointestinal tract, thus causing water and cat ions to enter. This leads to swelling and lysis, resulting in the death of the insect. Cry proteins were claimed to be digestible in humans, but a study has shown that the Bt toxin has been found in the blood of 93% of pregnant women tested and 80% of their babies' umbilical cord blood. Anytime my patients have elevated antibody levels to corn cry proteins, they are much more motivated to choose organic corn products. So, which patients benefit most from this test? Well, patients complaining of GI symptoms like gas, bloating, diarrhea, abdominal pain, nausea, and vomiting, or patients with known intestinal hyperpermeability. Also, patients with skin rashes or itchiness, bronchitis and asthma, arthritis or joint pain, muscle stiffness and swelling, or weakness and fatigue. Before we talk about complementary tests, I want you to think about Dr. Sidney Baker's TAC rules. Rule number 1. If you're sitting on a TAC, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2. If you're sitting on 2 TACs, removing one does not necessarily result in a 50% improvement in symptoms. In other words, sometimes there's more than one root cause contributing to your symptoms. In addition to the corn zoomer, consider a food zoomer bundle to assess immune reactions to peptides and other commonly consumed foods, such as the dairy zoomer, egg zoomer, grain zoomer, lectin zoomer, nut zoomer, peanut zoomer, soy zoomer, and wheat zoomer. Also, the food allergy panel to assess IgE immune reactions to 12 of the most common food allergens. Note, if this test is ordered, the results will populate alongside food zoomer results. And also the gut zoomer to assess for gastrointestinal imbalances that may potentially increase the risk for food sensitivities. And finally, total immunoglobulins to evaluate baseline levels of total IgA, IgG, IgE, and IgM. Serology testing is based on normal functional immunoglobulin production. The total immunoglobulins test assesses the number of immunoglobulins, which is helpful in those with suspected immune function compromise or those undergoing IV IgG therapy. In summary, the corn zoomer uses highly specific and sensitive microarray methodology to measure IgG and IgA antibodies to corn antigens. It also includes corn IgE, providing an in-depth assessment of reactivity to corn. To learn more, visit the link in the video description. If you have questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.